This is group 3 on the Duluth campus, and we are presenting on saw palmetto. And this presentation is given by Hunter Elgene, Allison Enger, Caitlin France, Marisa Harley, and Lauren Towley. So to start, saw palmetto is one of the most widely used herbal medications in recent times. Its most common indication is for the treatment of symptomatic benign prostatic hyperplasia, which is better known as symptoms caused by the enlargement of the male prostate. So there are a couple different dosage forms that have been used for this treatment. Saw palmetto itself is a berry, so one of the oral forms that has been explored is just taking 1 to 2 grams of the berries themselves by mouth once daily, as well as there is a tablet formulation that has been developed with dosages ranging between 320 and 960 milligrams, again, 1 tablet by mouth once daily. In addition, for the benign prostatic hyperplasia, there is also a rectal form, which is a 640 milligram tablet inserted into the rectum once daily. In more recent times, about 2019-2020, some clinical trials started being explored for saw palmetto's use in hair regrowth in patients with alopecia. And for this, an oral tablet formulation was explored with a 320 milligram tablet taken by mouth once daily, as well as a topical format in a lotion or cream that is applied to the scalp, arms, and legs twice daily. And historically, in Native American culture, there were some additional uses for saw palmetto. It was used for food and in teas, with some specific uses including sedation and helping in sleeping, as well as help with indigestion and urinary troubles, and then specific to women to increase fertility and aid in lactation.
Saw palmetto's effectiveness and potential benefits include the following: transurethral resection of the prostate and improved outcome of surgery, benign prostatic hypoplasia and the effectiveness for treating symptoms in the lower urinary tract, androgenic alopecia and its action against 5-alpha reductase enzyme to improve hair loss. Continued potential benefits: chronic pelvic pain syndrome and symptom improvement, and prostatitis symptom improvement of bacterial prostatitis combined with prulofloxacin.
And next, I'm going to talk a little bit about safety. So knowing the adverse and side effects when taking any herbal supplement is important because it's going to help consumers make educated and safe choices. A 2008 comprehensive review looked at 26 randomized, placebo-controlled studies and found the following side effects reported by most participants. Those side effects were headache, fatigue, extreme dizziness, which led to some nausea, and then GI upset, and those symptoms included diarrhea, vomiting, and GI bleeding. After the 2008 review was published, another research group decided to carry out a long-term study. What they noticed in the review published in 2008 was that not all of the studies that were in there included the same dosage among participants, and also most of those studies published in the review were short-term. So participants only took the supplement for about 1 month. In this 2009 study, participants took the supplements for 1 year. So this again was a randomized, placebo-controlled study. And what the researchers found was that there was no statistical difference between the placebo and treatment groups for all side effects and the urinary lab values. So the lab values they looked at included the urine pH, its specific gravity, and then levels of proteinuria, bilirubinuria, ketonuria, and glycosuria. From the other resources that I found, the saw palmetto supplement is generally well tolerated.
So saw palmetto is relatively easy to find and take and is quite affordable. It can be taken by mouth, rectally, or applied to the scalp for hair loss. When taken by mouth, the patient has the choice to use tablets, capsules, liquid extracts, or herbal tea. Herbal tea may be a pleasant alternative for patients who struggle or dislike swallowing capsules. The capsules can actually be opened up and used to make tea. A typical dose of saw palmetto is 320 milligrams once daily. This means patients usually take only 1 capsule a day if that is the chosen dosage form. Saw palmetto products typically cost around $10 and $15 depending on the dosage form. Capsules, tea bags, and liquid extract saw palmetto can be found at Walmart. The capsules can be obtained from major retail pharmacies as well in the herbal supplement aisle.
This is a summary of our recommendations for counseling when it comes to saw palmetto. So this supplement can be used to treat benign prostatic hypertrophy, also known as BPH, as well as androgenetic alopecia. Its price point is quite affordable at usually around less than 50 cents per tablet, making it quite accessible to our patients. When used for treating urination issues, studies have shown that it is generally well tolerated and can support the resolution of some symptoms of BPH. However, it does come with some common side effects, including mostly GI impacts such as upset stomach, nausea, and in more severe cases, GI tract bleeding. But more commonly, it includes dizziness, headaches, and fatigue. We encourage you to inform your patients that should they experience this, that they stop taking the supplement immediately and contact their healthcare provider. When used for the treatment of hair loss or alopecia, it is typically used topically, meaning that there are oftentimes less side effects as it is not being absorbed by the GI tract. It is believed to have a similar mechanism of action to finasteride, which is a commonly prescribed medication for alopecia. So this is a summary of our recommendations. Here are our references, and thank you so much for listening.